Do the obstacles to your dreams make you question your ambition? In this episode, I spoke with Dr. Dupe, who refused to let doubt hold her back and turned her vision into a reality as a femtech founder. Often, women face subtle messages that discourage boldness and ambition, suggesting that their dreams are too big or unattainable. Despite these challenges, Dr. Dupe's journey shows that with unwavering determination and clear vision, it's possible to break through barriers and redefine what's possible. Tune in and hear her inspiring story and discover how you can harness your own ambition and overcome obstacles and achieve your goals. Hello, tech leaders. I'm Carol Palombini, psychologist and tech leadership expert, and this is my podcast, TechMind Insights. My mission is to be the change agent for tech leaders grappling with communication issues, imposter syndrome, burnout, and the complexities of the leadership role. In this show, I interview leaders and consultants working in the tech space to provide you with real-world insights into the challenges of leadership. If you want to be part of the show or have questions you'd like me to ask my guests, send me an email or a DM on LinkedIn. And today, my guest is Dr. Dupe Burgess. I hope I didn't mispronounce your name. She's an award-winning founder at Bloomful, a company that is in the mission of moving women in from the margins to the center of the healthcare system. So Dupe, welcome to my podcast.
Thank you for having me, Carol. It's really great to be here.
Oh, I love your content, and it's really inspired to listen to your stories. And I'm sure everyone who's listening to us, either it be a man or a woman, they will benefit from this. So please just introduce yourself a little bit and explain what you're doing now.
Yes, so I'm Dupe Burgess. I am a London-based founder. I'm the founder of a health tech startup called Bloomful, and our mission is really to improve and streamline access to care for women's gynecological health. And how we are doing that is by delivering a digital therapeutic application, which provides women with holistic support around their gynecological health issues. Things like chronic pelvic pain from perimenopause, menopause, polycystic ovary syndrome. We know that these are conditions that firstly take too long to diagnose and to manage, but secondly are often quite poorly managed. We know that they require much more sort of multidisciplinary care, holistic care, but that in short consultations at the doctor's surgery, often that stuff is missed. And these are conditions that really impact women's quality of life, their mental well-being, their ability to work. And so at Bloomful, our platform basically delivers a lot of that very personalized, holistic support to women and helps them to take ownership of their health and also feel better. So we've been running for the last couple of years. It's been a really long journey of discovery, I guess, in as far as tech goes. We've realized that health tech's really hard. Like, it's really, really hard for a number of reasons. And so we've had to navigate not only that sort of vertical, but also a very challenging environment, being a female founder, everything that comes with that. So it's been a really cool journey, but I'm happy to dive deeper into any aspect of that.
Well, first, it resonates a lot with me with what you're doing with Bloomful, not only because I am a psychologist and I've always had this more broader view of the human being. Sometimes psychologists disagree with doctors as a strict biological view, especially when you're talking about women. So in the past, I didn't care too much if my doctor was a man or a woman, and now it makes a difference. And I really feel not more comfortable or understood by female doctors. Another thing that while we were speaking hit me the most is I don't feel safe enough to go to doctors nowadays, knowing what I know about the lack of research in the field regarding women, taking women as subjects on the tests.
Yeah.
And that I need to be equipped with information, with a lot of information before I go to a doctor, because I expect having to discuss something.
Yeah. Yeah, super interesting. And it's a very, very valid point. We know that the health system historically was built around men, specifically white men. And, everything we know about medicine is essentially based upon that model and then extrapolated to women and minority groups from there. So as you can imagine, women's health, especially gynecological health, has very much always been deprioritized and certainly not researched in the depth that it should have been. But beyond that, any condition, well, many conditions, I should say, actually women have a poor outcome because of the same phenomenon, because things like medications and, medical protocols haven't been appropriately researched in the female body. We have never taken hormonal changes, for example, into account with a lot of these conditions. And so women do have poor outcomes across quite a lot of medicine. So you're right to be very cognizant of that. And I think women should go into medical consultations with an understanding that they have to be as equipped, they have to be equipped with information, as much information as they can be before they go in, and they have to know what they want to come out of that consultation with. They've got to be ready to push back if they don't agree or they don't feel that the doctor's listening. And we talk about a lot of that at Bloomful, how to advocate for yourself in the medical setting.
Oh, that's amazing. And this is all due a lack of leadership, female leadership in the health industry, like making the difference. And now that we are finally getting there, there seems to be some reviewing in research. I've heard the other day one about finding out that women were hunters. That this has been excluded from the possibility from a biased looks of the archaeologists. So this is so huge. Can you give us an example, a practical example of how this lack of leadership in the health industry hurt women today in our daily lives?
Yeah, I mean, partly it is women's leadership, lack of leadership. I think before we even get to women's leadership, though, we have a fundamental lack of knowledge around these issues. So regardless of leadership, I think we are still far behind where we should be in terms of understanding the female body, the gynecological health process and systems, our hormonal cycles. When I was at medical school, we didn't spend a lot of time on these issues because there wasn't enough to teach us. It wasn't seen as a priority, but also it just hasn't been researched in enough detail. So I think that is the real starting point that we have to overcome. How do we get to the point where we can fund a lot of the research here and really understand the female form in the detail that we should? And then, of course, to your point about female leadership, I mean, I think personally, of course, when you get beyond sort of the middle ranks of healthcare, when you start to look at the higher kind of management levels and leadership levels, it is predominantly men, whether it be public sector or private sector. And of course, I think the consequence of that is we have fewer people pushing for this change. We have fewer people really driving that change. And that's because, for better or worse, regardless of which way you cut it, men are just not going to be as motivated, on the whole, aren't going to be as motivated to make a change. It's the same reason that we see really fewer women's health startups being funded by VCs, because men can't necessarily identify with a lot of these problems that we're trying to solve, with the issues that we face. These are very blanket statements that I'm making, but I'm saying on the whole. And so what that means is the money doesn't trickle down. So it's the same phenomenon when we look at leadership in healthcare.
Yes, you're completely right. And that brings me back to the question of how you got here, because you were a doctor, right? And now you are a tech founder. You're in tech. You're still in tech. Okay, it's still your playground, it's still your comfort zone. You're talking about something that you're super knowledgeable. But it resonates a lot with me. I'm a psychologist and I'm trying to fund a startup. So I think there are a lot of other women there who would love to take this path. So tell us a little bit about that, and especially the struggles that you've been through as a woman.
So I started my career, as you said, as a doctor. I came to London to study medicine, grew up just outside London, but I wanted to be here. I studied for 6 years at university, and then I worked in our National Health Service in the UK for a total of about 7 years. And during that time, I saw the problem, from in the clinical setting, that women were struggling to access the right care at the right time for their gynecological health. I knew that lots of women struggled to get diagnoses for things like endometriosis or polycystic ovary syndrome, even menopause. And I could see that many of my colleagues didn't have a clear understanding of those conditions too. I think at that time, it wasn't necessarily at the forefront of my mind to solve that problem, but I knew that I did want to leave medicine because I've always felt like I had something more that I wanted to give and offer the world, if you like. I was very ambitious and wanted to be challenged in a different way than what I was being challenged. And I wanted to have an impact on a bigger scale than I was able to. When you see a patient one by one, it's very small incremental impact, whereas I've always wanted to have a much wider impact. I've wanted to build something of my own. So eventually I did leave medicine and I went into the city. So I worked in consulting, management consulting. I worked for a global consulting firm called the Boston Consulting Group. They're quite well-known firm. They do lots of strategy work across different industries. And I think that was my opportunity to really learn more about commercial, about some of the kind of hard skills that we were not taught as a doctor, how to read a profit and loss statement, how to, business models, how to understand, how to build a whole spreadsheet, whatever it might be. And that was also my opportunity to learn more about the kind of technical side of healthcare from the back end rather than the clinical side. So that was, I guess, I came away from that understanding that you can solve problems in healthcare. We did a lot of healthcare projects around the country. And I think 3 years of consulting, I started to consider this problem that I'd seen in women's health. And I thought, maybe now's the time, now that I've got this toolkit, to revisit that problem. And so I decided to do that. And by this time, people were talking more about women's health. It was sort of post-COVID or COVID time. People were talking about inequality a lot. We were hearing more about the problems that women face for many of these conditions. And I felt it was the right time to take my clinical knowledge as well as my commercial experience from strategy consulting and try and build something of my own. So that's when I started Bloomful. And that's when I decided to go all in, if you like, in tech. And, it's been a really interesting journey because I hadn't worked in tech before. So I've had to, as you know, you kind of have to really try and understand the landscape, understand the tech sector in general, and then kind of deep dive on the area that you want to build in. So it's been a real journey of discovery over the last couple of years.
Yes, and I loved how you started with this clear vision. It seems like your vision and purpose, and you knew your desire. Most of the women that come to my office, of course, they need help, but they need help with finding their own desire. And it's super interesting to check if to realize that they don't know what they want because they're too connected to what the others they love need.
Right.
So it seems like you've had your own ambitions, and talking about ambitions with women, it's harder. It's easy to approach the subject with men. Okay, it's okay to be an ambitious man, but is it that okay to be an ambitious woman? I don't think so. I don't think that people really encourage us to be more. You were already a doctor. What could you want more than that? Don't you want too much? So I think that this is really beautiful that you knew that and that you had this purpose. And then using the consultancy as a step into entrepreneurship, I think it's a very good strategy. It's the one I used as well. So I was working as in HR, as head of HR. I knew that there were a lot of problems there. And then you go to consulting and you say, oh, the things that I thought I was going to solve are pretty different in other places. They have other issues, how they deal with these issues. So it gives you like this broader perspective on the issues that you already had.
Yeah, absolutely. It gives you a different lens, and for me, I needed that lens, especially in healthcare. I think it would have been very difficult for me to go from clinical medicine straight into trying to build a company. You almost need that segue process, you need that area in between to really understand and immerse yourself in what the problem looks like from the business perspective, before you can dive in and do that.
And what were the obstacles that you found in this journey, especially as a woman?
Yeah, gosh, there's been a few across right through my career, actually, right the way from applying for medicine. And to your point about ambitious women, I agree that it's less accepted, perhaps, that women can be ambitious and really bold with what they want and what they're demanding. When I was at school and I was applying for medicine, for example, I remember, even though I was a straight A student, always did really well at school, I remember that my teacher tried to almost discourage me from applying to become a doctor because it was almost, well, what do you think you're doing? I did it anyway, and I got my position with no problems whatsoever. And then when I wanted to leave medicine to go into consulting, it was that same narrative of, well, what do you think you're doing? This is where you belong. You've done this is the career that you've chosen and you have studied it, you've worked in it, what a waste it would be to move into consulting. I never saw it as a waste. I see it as stepping stones in the journey, but people will try and talk you out of things because they think that you kind of belong in this place. So I've always been someone that's kind of gone against the status quo in that way. And since being in tech, obviously there are many, I guess, biases that women can face and do face. I guess for me, the biggest thing, or the time that sticks out in my mind most, is when I was raising capital for Bloomful. So I did an angel round about 1.5 to 2 years ago. So, that was the first time that I'd ever tried to raise funding. Obviously, it's a very strenuous process. It's a long process. It's quite a painful process, especially when it's the first time you're doing it. And, for me personally, I think you've always got that voice in your head that is an echo of the data that's around. We know that women are less likely to raise money. We know that minority women are even less likely to raise money. And it's really difficult to kind of close that off and not think about those statistics. It's hard to kind of distance yourself from that. So I think that's the starting point that women have compared to men already. It's like a psychological thing. But even besides that, I think when you're talking to investors, you have a situation where many of them are male, most of them are male, so they don't have an innate understanding of the problem that you're trying to solve if you're working in women's health. So you have to spend a lot of time discussing that and explaining what the issues are, convincing them that that is a problem, that there's a big enough market size. And I think one thing that was apparent for me, at least at the time, was an issue that I was also facing, was that when I was fundraising, I was actually pregnant as well. And so there's the added thing of, you're a female founder, I'm a Black founder, I'm a solo first-time founder, I'm somebody that's building in women's health space, which already has its own kind of biases, I guess. And then on top of that, I'm also pregnant. So there are so many, as a woman, there can be so many kind of interlinking biases that work together to just make that a little bit more difficult. And even if it doesn't make it difficult, it plays on your mind when you're trying to complete that task. So it's like an added burden. So, I did most of my fundraising virtually, through calls like this. So that helped. But, I did have the odd comment or discussion around what my plans are as a woman of childbearing age. Is this going to be, never saying it explicitly, but asking whether I'm going to be well supported enough to actually succeed in this business. And yeah, that's the major challenge I think all women of my age.
Yeah. Why do you care what I'm going to do with my baby? Because I've been there, but I wasn't funding, but I was looking for a job at the time. So it's kind of the same. You have the interviews and they're all asking what you're going to do with your baby. And I say, you don't have to ask me. In my mind, I would say, you don't have to ask me that. Just ask me if do you accept the job? If I accept the job, I'll handle it.
Yeah.
So, what do you want me to list a bunch of lies just to get or something like that? I'll get it done. And I think that I would love to know how you actually in reality responded to this. I think that we all want to know, because you actually, in the end, you got the funding.
I did. Well, to be honest, I responded by doing the best I could to minimize as many variables as I could. In other words, I got to the point where I didn't discuss being pregnant at all. I kept it to myself. I fundraised through virtual calls. I kept it shoulders up only. And I managed to raise my funding by basically not talking about it. And I don't think that's the best way. I'm not advocating for people to not, tell whoever they want that they're pregnant if they are. I think we should be able to bring our whole selves to these conversations and speak openly. But the fact of the matter is, I felt like I couldn't. In that situation, I felt like I had to start, I had to kind of pull back on that detail to get this closed and to get what I needed to get. And, my theory has always been, do what you've got to do, get where you need to get to, and then you have more power to make the change that you want to see.
Yeah, I totally agree. All this talk about vulnerability, you have to bring your vulnerable self. It's easy for a white man to say. It's very hard for you to be your true self when you are an outsider, when you are a minority, when you have to be watching every step that you take. You have to watch every tone of voice
Yeah.
that you raise, and the cultural biases that they have, like me as an immigrant, for instance, that they have a lot of this problems here that they make different interpretations of something that's just cultural. So you have a lot to be concerned about. So I don't advocate for this. I am the champion of the ethics thing.
Mm.
You know,
No,
I'm the savior, and I'm going to the sacrifice mindset, because in the end you will be sacrificing a lot because you didn't get a good reading, a good political awareness, if we're talking about emotional intelligence.
yeah,
So if
exactly.
you don't understand how the game is played, you're not going to win this game.
No, exactly. And I think we have to start from the position of we need to win this game. Like the only way that we're going to have enough power collectively as women is if more of us get to reach that end goal. And so you kind of have to solve for reaching the end goal first and foremost, and then you can work backwards from there and start to make the changes once you've done that.
Yes, and I've tried to make these changes, especially because I worked in HR, like inclusion of black women in the team, inclusion of LGBTQ people. But since I was not yet in this executive position of decision, my decisions were overruled
Right.
afterwards. So I got this I felt this. If I don't get there, if I don't get to a leadership position, I'm not going to make the difference.
Mm.
I'll
Exactly.
try a lot, but this thing that each one does their part, it's not like that. There are some people, there are decision makers, and their decisions make huge impact.
Absolutely. And you've got to play the game. You've got to be strategic in getting to that position so that we can then lift other people up.
So I'm sorry, we are reaching the end, because I promise everyone that my podcasts are super short, but I'm really sure we have a lot to discuss only about this vulnerability thing. We could do a whole episode just on that.
Yeah.
So I would love it if you could give us a recommendation of our readers, any recommendation of read or content or a podcast, something that you think that will help other women go through this journey.
So a book that I really like is a book by Simon Sinek called Start With Why, because I don't know if you've read that one, but I think it's a great book for just really understanding your purpose in life and understanding, what kind of imprint you want to make on the world, why you're doing what you are doing. And that to me has always been a great way to I bring everything back down to why. So why am I behaving in a certain way? Why am I making certain decisions? Why am I not sharing my pregnancy? A lot of that, if you keep asking yourself why, you can get right down to your personal kind of values, your personal mission. And I think that was a great book for really helping me to get clarity on those things.
It is, and I loved whenever people mention this book or the why, because I use this a lot as well. I mentioned that the why here is more of a what for than like trying to bring the past reasons of what you're doing this. Like, because some people go to this why exercise in a wrong way, and they end up like only scratching the pain, like only ruminating the problem. And what we want is the what for. And I think this is a beautiful way to end the podcast, because purpose, having clarity and confidence in your purpose is probably the best tool you have to overcome the biases.
Absolutely, 100%. I think that's kind of your anchor for overcoming things. Like, why are you doing it? Who are you doing it for? What's the reason? I think if you can keep your kind of guiding light as that, I think you will always end up where you need to be.
I love the compass metaphor, because it always it shows you your North Star, where you have to be headed at. It doesn't take you out of your focus. So I love that. And if people want to reach out to you, if they want to connect with you, how can they do that?
You can connect with me on LinkedIn. I'm active on LinkedIn every day. I try and post parts of my founder journey, my kind of personal development journey, and about entrepreneurship. So it's Dupe Burgess, Dr. Dupe Burgess on LinkedIn. And you can also follow Bloomful as well. We have a LinkedIn page. Check out our website. And yeah, that's it.
Yes, it's amazing. I've been following you for a long time, and I just reposted one of her posts. So I hope we can continue this conversation in a lot of other episodes. So please ask me if you have any questions about Dr. Dupe's work, and if you want to listen to anything specific, just send me a message and I'll talk to her and we will agree a second episode. So thank you, Dr. Dupe, very much, and everyone for listening to this podcast. And I'll see you on the next episode.
Thanks for having me. Bye.